This is episode number 4 of A Couple of Dumbbells, the sports medicine umbrella. Welcome back to A Couple of Dumbbells. My name is Erik Braun, your host and athletic trainer, helping you to opt for greatness. This week's episode is going to focus on the sports medicine umbrella, what that is, who is a part of it, what makes up the sports medicine umbrella, and how you can use that to optimize your performance and get back into your function. When an everyday athlete starts a new job or gets into a new team or a sport, they see a lot of different professionals helping them opt for greatness. This could be a personal trainer, strength and conditioning coach, or this could be an athletic trainer, doctor, physical therapist. All of these individuals fall under different branches of the sports medicine umbrella, but all of them work together to help the people they serve and help them do great things. After giving you a definition of the sports medicine umbrella and talking a little bit about these professionals and what they do, we're going to go in how they work together and how you can utilize them to help you on your health and wellness journey, whether that be in your job or sport or everyday life. Knowing who to go to and knowing how to approach them is a vital aspect to the process in achieving your fitness goals. Of course, staying safe throughout that entire process is paramount. So by understanding the sports medicine umbrella and how to make it work for you, I hope you guys are able to walk away from this episode knowing who to talk to and knowing how to arm yourself with the information and techniques to avoid injury and maximize your performance. At the end of the day, the questions that you pose to these professionals will help guide your treatment and your workout program and opt for greatness. So stay tuned. We'll be right back. When I first decided to make a podcast, I thought I was going to have to learn all this stuff about audio editing, distribution, and any number of things that go with making a successful podcast. Fortunately, Anchor exists, and it is an extremely easy way to start out. Let me tell you a little bit about them. First and foremost, they're absolutely free. You don't even need a credit card to sign up. They have the creation tools that allow you to record and edit your podcast right from your phone or your computer anywhere in the world. After you complete the extremely easy process of making your podcast, Anchor will distribute it to Spotify, Apple, Google, and many other podcasting mediums so the entire world can hear your message. Another cool thing about Anchor is that you can make money with your podcast with no minimum listenership. It's absolutely everything that you need in a podcast in one convenient place. Download the free Anchor app or go to anchor.fm to get started. That's anchor.fm, the easiest way to podcast. "99% of the time, the only obstacles to success are the barriers that you put there yourself. There exists only a limited set of circumstances that are physical in nature that prevent a person from reaching their goals. These physical circumstances are something like a disability or an external factor that is outside of somebody's control. However, you look at multiple examples throughout history of somebody overcoming a vast amount of adversity or a disability to reach true levels of success. These people aren't superhuman or had some other thing involved or crazy. They just refuse to accept their own circumstances, and they refuse to accept the physical barriers that kept them in place. They had to overcome the mental barriers, the aspects of their own personality, whether it be self-confidence, anxiety, lack of understanding, any internal factor, in order to find out the steps that led them to greatness. These people made it seem like they had no other choice but to succeed at what they set their mind to. These types of people found their fight, and that biggest fight was against themselves. Oftentimes you see your opponent in a fight and you get scared, but all that fear, all that anxiety about the person you're facing off against is coming from the conclusions that you made within yourself. We could go on and on and on about all the different anxieties and fears that you have when it comes to a competition or a certain journey that you're on. 99% of those feelings are attributed to your own internal mindset and your own conclusions. Don't make assumptions. Don't make conclusions. Don't allow a negative internal monologue to disqualify you from your success before you even get started. So I wanted to take some time this week focusing on this sports medicine umbrella, what that really is, who works under that, and how that's applicable to the everyday athlete and to everybody that undergoes a health and wellness journey. So first off, let's talk about what sports medicine is. So obviously you have the medical side of things where you're focused on the body, you're focused on the healthy state of being, and you're also focused on the disease state of being or a conditioned state of being. So medicine is not just what it is when you're hurt or what it is when you're injured or, sick. It's in general just human wellness, human being, focusing on maintaining that level of health and keeping you on your own, individualized. That's just medicine in general, optimizing your health so where you can enjoy your life. Now you throw in sports medicine. And so a lot of people think of sports medicine as focused purely on a competitive athlete or people that are active or anything of that sort, where in reality, sports medicine helps out a number of people regardless of function. So an athlete, the term athlete has really broadened out in these past couple of years, even in the short time through my education in college and then my first couple of years working in the field. The term athlete has really expanded and evolved into something outside of people who participate in sports to any degree. So that's why I use the term everyday athlete, because all of us are athletes. So you got your commercial office athletes who, it's sitting at a desk. You still have to provide yourself a level of health and wellness and endurance to sit up, get there, and reach overhead and do all these little things so you can go about your everyday life and not come home at the end of the day with a sore back from sitting. So that's part of the ergonomic approach that sports medicine professionals can help you with. And also you have your industrial athletes, ones that work in the factory or ones that work in some sort of trade or construction, that they have a level of fitness that they need to own up to in order to complete their job. So again, the term athlete has really expanded out, not just people who play a sport, but people who need to perform well in their everyday function. So when we talk about sports medicine and how it applies to that, sports medicine will help everybody and finishing their job and finishing their function. When we talk about sports medicine professionals and the sports medicine umbrella, you actually are probably working with one of these sports medicine professionals to help you complete your job. Sports medicine in general is very broad. So we have to expand that out. It's a whole umbrella terms. We can generalize it down to two different branches. The first branch, the one that a lot of people will see and a lot of people think of when they look on social media or anything like that, is the performance enhancement branch. And that's going to be people who are more focused on optimizing, maximizing your performance in whatever your given function is. So one that's going to be most available to the general public is access to a personal trainer. A personal trainer is somebody that could be accredited through any number of organizations. There's the National Academy of Sports Medicine, the National Strength Conditioning Association, the American College of Sports Medicine, you name it. There's a lot of different certifications from a lot of great organizations out there. These personal trainers are going to sit down with you, identify what your goal is, whether it be aesthetic based, like losing weight or gaining muscle, or performance based, or getting better at a job or working better in a sport. And they're going to help you on a personal level, on a private level. So that's somebody that you hire, you pay money towards, and they help you reach whatever goal you tell them based on whatever deficits that they would find in a basic movement assessment. So they actually fit under the sports medicine umbrella because they're helping to reach a goal, enhance your performance, and in some aspects also prevent injury by staying fit and also addressing certain deficits that they might see in whatever gym or whatever private setting that you are in. Another professional that you're going to see under the performance enhancement side of things is the certified strength conditioning coach. So that's CSCS. They're certified by the National Strength Conditioning Association, the NSCA, and they work much more hand in hand with a team-based or an athlete-based. So they work a lot with sport. A very common place for them to be is like on a college staff as a strength conditioning coach, or in a professional sports realm. That's who you would see. Those are the guys that are prescribing the exercises and the programs and initiating a lot of these injury prevention programs to help their athletes or help the people that they work with maximize their ability on the field. They do this through any number of ways, and they work very, very closely with the other side of things, the injury rehab sort of thing. So they fall under the sports medicine umbrella in a very important sense because their role is to keep people from going into that injury prevention side of the sports medicine umbrella. Ideally, if they're enacting a great individualized program that's addressing the sports profile of whoever they're working with, they're able to identify certain deficits of a particular athlete, strengthen them in that area, and also strengthen them in order to adapt and react to different circumstances on the field. So a great strength and conditioning coach pays dividends to a program or a company or whoever they happen to work with, because they're trying to get on top of any issues or any risk of injury before they actually occur. There's any number of individuals under the performance enhancement side of things. Other these individuals might be a coach as well, so a position coach in any certain sport, or a risk management person in an industrial or office setting. They coach you on proper tips of lifting techniques or anything of the sort to stay safer on the workplace. You can also look at sports nutritionists or dietetics that help you to fuel yourself, hydrate yourself to be able to reach that upper level of performance or make sure you're avoiding injury. Then if you work from a clinical perspective or you work from a lab perspective, you could look at somebody like an exercise physiologist who can enact any number of, can use any number of technologies or any sort of scientific background to identify, like, okay, you are here based on this scale. So for example, let's just say we're looking at a VO2 max, which is a good measure of cardiorespiratory function and endurance in athletes. So say I have this cross-country skier. They typically are on the very high ends of VO2 max scales. Say I had this skier, they wanted, like, hey, I got this race coming up. I want to test my VO2 max to see where I am versus where I should be. So like an exercise physiologist can work with that. So all of these individuals that I just spoke of, they're going to address one half of the sports medicine umbrella, and that's the performance enhancement side of things. So you're going to go see these people for anything related to your performance. Say there's an area in which you want to improve as part of your game or your function or something that they notice. They can take that time, point it out to you, and you'll be able to work with them to address that specific area. Now let's flip over to the other side of the sports medicine umbrella, and that's the injury care and management. So these are the people you're going to go see if there's some sort of condition or some sort of injury that you sustain and that they need to help get you back into the field of play or keep you in there from a prevention point of view or from a maintenance point of view. So there's a lot of these different professionals that you could see in a physical therapy clinic or within your sports setting. And of course, first and foremost, I'll speak to my role as an athletic trainer. So athletic trainers are typically the gatekeepers to the extended world of sports medicine on the injury care side of things. So in a team setting, we're usually the first line that sees people. We'll see people on the field if they go down or if they come to the athletic training room with a concern, and we work really hard in the prevention sort of things to avoid any of the concerns that pop up. This can look like any number, where there's any number of modalities and treatments and exercise protocols that we can enact that help to maintain and prevent injury, but also any number of short-term things when there does become an issue, say a grade 1 ankle sprain, that we can work with our overarching doctor, the person that supervises the athletic training practice, to help rehab them and get them back on the field of play. In the state of Michigan, an athletic trainer must work under a sports medicine doctor or a practicing physician, licensed physician, in order to practice by themselves. So the physician will have standing orders that they work together with the athletic trainer to provide for their practice. So while the physician might not be in the athletic training room the whole time, or they might not be in the physical therapy clinic, they have these orders that oversee the athletic trainer. So as my role as a gatekeeper, I will have to know, okay, here's what the standing order says. And then I also, through my evaluation of the everyday athlete, have to figure out, okay, what can be done here? What can be done to keep you in? Or does this warrant further evaluation? Do I need to get you in to see a doctor? Let's say you do. So I would refer you on to either your own doctor or the supervising physician that I would be working under. So that's going to be kind of your first step in this injury care process and the sports medicine process, is seeing a physician to help kind of guide you on your path. From there, based on what they find, you might need you might need to go see a physical therapist. They might be a sports physical therapist. You might need to go see a surgeon if there's a issue. Maybe, a lot of times people look at ACL issues for athletes. There might be something on that side of things. So from there, you could see any number of injury care specialists. Again, you have the physical therapist. There is actual massage therapy as well that helped kind of with the rehab side of things, and even sports dentists. There's osteopathic medicine, there's sports chiropractors, and there's any number of specialists. It could be a shoulder, elbow, hands, knee, hip, foot specialist that you're going to encounter in the injury care and management side of things. So I'm going to take you through what you would expect as a athlete of any creed when you go through an injury care sort of thing. So I'm going to say for a football athlete, that's going to be a big thing. People right now are talking about how football is going to get back into America and get into play with the current COVID-19 pandemic. And we're trying to figure out a lot of different things of how to get that back and to get the players to play in a safe manner. And the sports medicine professionals, the athletic trainers, the sports med doctors, the physical therapists, they're all trying to find ways to make sure everybody stays safe. And one aspect of that is that a lot of these players have unfortunately been on the sidelines or away from a gym, so they may not be up to the physical standards that they're used to being at this time of year. So let's go through what one of these athletes might unfortunately encounter if they sustain an injury getting back during the season. So say within the first couple days of conditioning of camp, I get an athlete that comes in to see me as an athletic trainer saying, man, the back of my leg is really killing me. I think I pulled my hamstring. Very common issue to occur. A lot of times hamstrings are the number one issue of time loss injuries amongst athletes. So, there's any number of things that I can do as an athletic trainer when you come into the athletic training room to see me to help that hamstring out. So I'm going to evaluate it, and I'm going to look at, okay, to what degree is it really the hamstring? Is there something else? Is there something else outside of the hamstring that's attributing to this pain? Could it be something in my hip, something in my back? There's usually other areas of which we can address to help your hamstring out a little bit more. So I go through my evaluation. Yep, you got a hamstring strain. It's not that bad. You're still walking around. It's just a little bothersome. It's not anything you're going to lose any drastic amount of time in, but maybe you were a little bit, under conditioned going into it to where your hamstring was kind of the thing that gave out on you or gave you a little bit of issues. So in the athletic training room, if there's a minor hamstring strain, they're more than likely, as a standing order, I more than likely have the experience to be able to help alleviate some of those symptoms, give you some strengthening and conditioning exercise specific to that area to be able to get you back onto the field with relatively minor discomfort. And maybe we control your load in the weight room and we work together with the performance enhancement side of things to make sure we're not overloading that hamstring, but we're still giving it more strength and better conditioning to be able to handle the demands of your sport. Now, let's say you come in, your hamstring's like, oh man, like I heard a pop, and my hamstring, the back of my hamstring is killing me. I go through there, say I'm doing some knee tests, and I find some things with your knee that just don't seem right, something with my evaluation, and then, say I'm feeling your hamstring and I feel something in the muscle. I'm like, all right, like there's something more going on here. So I might refer you to the sports medicine doctor that oversees kind of the whole thing. Now, for a professional program, for like something like the NFL, those doctors are already there. They're there the first couple of days, and especially now they're trying to take charge of what's going on. So you get referred out to the doctor, the sports medicine doctor. They do their testing, their evaluation, and they're the ones who are going to dictate the treatment plan from there. They may determine that, okay, so yeah, it's more of a hamstring strain. Like, we got to go in and make sure we're doing this with the sports physical therapist, putting them on a more extensive rehab plan before they get back onto the field. Now, during the course of that, they might find something else that attributes to that kind of hamstring pain. So a lot of times when you look at somewhere else, you find something in the knee that just isn't right. So maybe they find something, they felt that pop, but it's actually looking like during the evaluation, there's something going on with those ligaments. Maybe there's an MCL problem, maybe there's a PCL problem, one of the ligaments in the knee, that they're like, we gotta do a consult, we gotta get an MRI, we gotta do something. So they're gonna get referred out to imaging and go through that whole process until they determine, okay, is this something that we need to talk to the surgeon about? Is this something that we need to talk to the rehab team, a physical therapist about? They're going to make that determination. So just based on that initial experience in the athletic training room, whether it be, we used football in this example, but this could be something that you do even in an industrial setting, as more athletic trainers are sitting in the industrial realm, they're going to be able to refer you out and kind of expose you to all these different professionals under the sports medicine umbrella to get you the kind of care that you need and to get you that sort of understanding. Now, where this all kind of ties in. So of course, I just went into depth about everything injury care and management. Being somebody that's in that side of the sports medicine umbrella, that is a lot of what I see on a daily basis. Now let's talk about how people can kind of merge that under one umbrella. So I want to merge the injury care and management side of things into the performance enhancement side of things. So in my experience, my limited experience, any good sports medicine team seamlessly merges the performance enhancement and the injury care aspect of things. And a really great philosophy that I've heard going through it is that if I can make the performance enhancement side of things, so my strength and conditioning coach, my coaches, my sports psychologist, my nutritionist, all work together cohesively in identifying potential red flags or potential problems of deficit before they become an issue to where they have to come over to the injury care and management side of things. That means I have a whole team that is very well versed in trying to make sure all these athletes and make sure all my workers are in tip-top shape, and you end up mitigating the cost of healthcare because you don't have to go through all these imaging and tests and seeing all these doctors to figure out what's going on, and you can still be productive in your sport or function. So you're still bringing home your paycheck, you're still contributing to your team, and you're doing things with the performance enhancement side of things before they ever become an issue. Because by the time you get to that injury care side of things, by the time you come to see the athletic trainer or go to see your doctor or go back to your physical therapist, it's already too late. There's something that occurred that is going to have an effect on your function. Now, you may still be able to perform. Not every injury is a time loss injury, but there are a lot of them, and unfortunately, that's very taxing on the athlete because you want to get back, you want to feel proud in your function, but you want to do it safely and you want to get over that block in your head. So we ideally want to keep you out of the doctor's office or the athletic training room. So as part of the sports medicine team, I'm working together with my strength and conditioning coach, with my performance enhancement specialist, in order to identify areas like, hey, so we see a lot of this happening last year, we saw a lot of this happening last week. What can we do in the gym or what can we do in the workplace that's going to avoid this and make sure people stay safe? How can we make this so nobody has to come see me? Because I love seeing you guys. I love hanging out with people, athletes, anybody. But ideally, you're coming in to say hi. You're not coming in because there's an issue, right? We want you to stay safe. We want you to be healthy. So where a good sports medicine team really thrives is if there is a good back and forth between the strength and conditioning side, the performance enhancement side, and the medical injury care side of things. So there needs to be a lot of dialogue. There needs to be a lot of things. And how that works best for the everyday athlete, the person who is not educated in the sports medicine realm of things, is that sort of collaboration, that sort of conversation. So knowing who to go to and having the priorities set in my mind, like I need to make sure that I am talking with my strength conditioning coach, or I'm talking with my athletic trainer or my doctor or my position coach or my risk management officer to make sure that I'm avoiding behaviors and I'm identifying deficits in my movement that could open me up to potential injury. And then also, you know, if you do want to go in and say hi to your injury care team, go in and say hi to your doctor, your physical therapist, athletic trainer, you could ask them, be like, hey, like, you know, I'm worried about so-and-so, like, help me out. Like, what do you think I could be doing? Or like from a mobility perspective, what exercises might help me out so where I'm not having this issue? And just kind of being open and honest with these sorts of professionals and just really performing a personal inventory. Be like, okay, let me think about it. Like, what areas do I know that I need to work on? Do I need to work on this aspect of my game or this aspect of my function in order to get back into play or avoid having to go see the athletic trainer? Conversely, say there is something that happens, your hamstring is bothering you, your ankle's bothering you, you got a little bit of back pain, something you think is minor, you do need to go see the injury care people. You need to go talk to the athletic trainer or your doctor sooner rather than later. The odds are that if you get on top of something that is minor or you think it's just nagging at you, it's going to be better for you long term. The injury care team can figure out something that works for you to prevent it from becoming a bigger issue down the road. Maybe it's correcting a movement pattern, maybe it's strengthening a certain level, a certain muscle, or conditioning something. The sooner you get in, the more honest you are with your injury care team and your sports medicine team in general, the better the outcome is going to be for you personally and for the team when it comes to a performance perspective. So let's kind of summarize everything that we talked about. Sports medicine umbrella is a very broad term. It applies to everyday athletes of every level of function. There's two different branches. You have your performance enhancement side of things that work on optimizing and maximizing your performance. And there's the injury care side of things that works on observing what deficits and conditions you may have and getting you back onto the field of play. A really good sports medicine team collaborates well in order to identify certain issues or movements or behaviors that could negatively affect you and your function before they become an issue. How to make the best use of this team and how to make the best use of your sports medicine healthcare is to be honest and open with these individuals, your performance enhancement specialists, as well as your injury care team. Odds are you can get into them and talk about your personal inventory, things you're concerned about, or certain nagging issues, and get rid of them before they become a massive issue. Talk with them early, talk with them often, get in there to make yourself the best that you can possibly be, and ask questions. You know, that these sorts of questions help direct practice, and these sorts of questions help direct the sort of research that the sports medicine professionals do. And you might ask them something that they're very knowledgeable about, or you might ask them something that they need to do more research on. In the end, they're going to find an answer for you, and they're going to find ways or other people outside of themselves to help you opt for greatness and maximize your performance. That is a wrap on episode 4, talking about the sports medicine umbrella. Thank you guys for tuning in so much. I hope you guys learned something out of that and know who to go talk to and how to help yourself opt for greatness. If you loved this podcast, please follow us on wherever you're listening to us on. You can also go to anchor.fm, a couple of dumbbells, to support us with monthly donations. Be sure to head over to our social media pages at OPT Athletics on Facebook, Instagram, and Twitter. Follow us for some workout tips and advice to help you make the most of whatever level of equipment you may have. Here in Michigan, gyms are still sporadic regarding their status, so we are still working out at home, finding ways to challenge ourselves with body weight and versatile gym equipment that is cheap or easy to find, or things that you can use around the house. If you guys have any questions about the show, feel free to reach out, send us a message on any of our social media platforms. You can also shoot us an email, optathletic@gmail.com. That's optathletic@gmail.com. Let us know what you think of the episodes, or send us any questions you may have about the professionals under the sports medicine umbrella. Thanks for tuning in. Stay well and opt for greatness.